Welcome back to Coffee Talk with Mike and Janell. We are on episode 22. And as we promised last month, we are going to take some time to talk about how to choose a provider that's appropriate for you and your family. This is a very daunting task. There's so much to consider. What type of practice this provider will be working in? Are they even available? Are they going to be a good fit for your family? All sorts of things. So, Mike, would you please elaborate a little bit on all of these topics?
Sure. Well, welcome back, everyone. Yeah, this is a really difficult conversation and concept to have, right? Because on the one hand, I think we're going to give you a lot of kind of pointers and things to consider when choosing a provider. On the other hand, we also have to acknowledge the fact that there's not that many providers out there who work with the IDDD ASD population, and there's even less who are really good at it. So we get that some of these recommendations may not pertain to you, particularly if you live in a relatively underserved area. But what we like to always do, whether we're talking about treatment plans, medication strategies, placements, is think about what the ideal thought process is, and then of course we have to adjust that based on what's actually around. So I think the first thing is talking about like the type of provider. And let me start with just a caveat. So we use the word in Coffee Talk, prescriber, frequently. We do that for sake of clarity. By far, the treatment for autism and other developmental disabilities is not medications. They can be part of the treatment plan. They should not be the major part of the treatment plan. We've talked about polypharmacy and things like that in the past. But we use the word prescriber because very often that's what people are looking for. And prescribers can come in all shapes and sizes. So from a medical doctor standpoint, you could have a primary care physician, a neurologist, a developmental pediatrician, a psychiatrist, child psychiatrist, and then certainly from our allied health professionals out there, nurse practitioners, physician assistants, and I want to give a couple pointers or tips about each level of practitioner, but knowing that these are only kind of generalities. We've worked with PAs and NPs who have a passion for this population, who are well-read, who have a wealth of experience and are the single best providers in their region. And we've worked with child psychiatrists who have been trained even at autism centers, who I wouldn't necessarily refer someone to. So there is that thing, but I think people should come out of this first part of at least a basic understanding. A child psychiatrist such as myself, 4 years of med school, 4 years of adult residency, 2 years of child psych fellowship. And even coming out of that, to be honest, I'm not positive I was really all that well qualified to work with this population. The training regimens go down as we kind of move down that ladder. Neurologists see a lot of people with autism and other developmental disabilities, particularly those with seizures, other neurological problems, and they have a better sense of many of these meds and maybe PMD. A primary care doctor, though, who works a lot with this population, may be wonderful, but keep in mind they probably have about 3 years of training, and they have to take care of the entire child, the entire adult, so not just behavioral things.
And I think what you had just said was, textbook is great. It's great to have that knowledge, but one autistic child is one autistic child or individual. No one is the same. So I think the experience piece matters the most there.
Yeah, I would agree. I mean, when we move to nurse practitioners and physician's assistants, their training is less. It doesn't mean it's not valuable. It doesn't mean it doesn't make them qualified. There's a little bit less of the pharmacological training, the pathophysiology training. We've talked in other episodes about diagnostic clarity, particularly with medical comorbidities. But a well-experienced PA or NP who looks globally at a case and understands what goes on in the system of care, the educational care and other supports, is going to be far more valuable than a child psychiatrist who only knows about meds. So it really is that individual fit.
And there's any number of PMDs or pediatricians who consult with us who are very proficient and will just call to consult if they have a question or concern. So it's worked out wonderfully.
And to be honest, that's my preference, to working with a primary care doctor, because they're focusing on all the medical comorbidities, and with the right support, they can do this very well.
Absolutely.
So, you pick someone who's available, but it's important to at least understand what these differences are. So then the next type of thing is like, what type of practice, regardless of the type of practitioner, what type of practice do they work in? Is it a private practice? Is it more of a mental health clinic that happens to see some people with autism or developmental disabilities? Very often they will not see folks who have very few words. They will not see folks whose IQs are, kind of down in the 60s and below, but sometimes they will. Is that hospital-based or medical school based system. They all have their own pros and cons. We work very well with all different levels, and sometimes like the medical school, university-based systems are not the gold standard in the community. There may be a private psychiatrist or neurologist who does wonderful work in a private practice, but they all have their own strengths and weaknesses. And one of the things you really need to consider is, do they have therapy, or is therapy a requirement? In a lot of mental health clinics, they actually lose money on doctor appointments and they make money on therapy appointments. So you have to see a therapist to see the psychiatrist. Well, if the type of therapy that they provide is not one that your child or loved one will engage with or can engage in, then you're going to lose that linkage very quickly, because you're not going to be able to attend the therapy appointments.
It's going to be frustrating, I think, on both ends. Yes.
If you're a private practitioner, do they work with therapists or behaviorists in the community? Probably the most important thing is, regardless of whether therapy is clinic based or external to the practice, what level of communications happen between the two? Misdiagnosis and lack of communication within the entire treatment team is what leads to polypharmacy. And so it can be done well in any of these settings, but you should have a general sense of what that setting is and what they have available for you.
Right. And I know Telepsych is huge now, especially since COVID pandemic, but I think that could be helpful and useful for follow-up sessions, and if it's amenable to the individual who's seeking that care. But certainly you'd want a rapport, and you'd want to meet with the person, the provider, in face-to-face initially.
Yeah, absolutely. Telepsych has been wonderful. It kept us alive during COVID. It allows us to follow our patients. It's also a lot easier for the practitioner. And we have cases now. Office visits should be in full swing right now. It doesn't mean we still use Telepsych.
Right.
But that Telepsych is now the default.
Yep.
And very often the child has not been even visualized for 6 or 8 months. So it has its place, but it shouldn't be the only thing. Absolutely. Great point. When you start looking, okay, we've talked about type of provider in general, type of practice in general. Now you have to talk about some really specifics when you're choosing where you are. And again, I get that there are some places that there's literally one show in town. And so, unless you're going to drive 300 miles, that's what you're getting, particularly in rural areas. But how much travel is going to be involved? We consult on cases, maybe work with them and take over the case for a while, and families are like, can we stay with you? And we'll drive anywhere. We have families, willing to fly, from North Carolina to come up for an office visit with us. Well, during a time of crisis and urgency, that may make sense. But regardless of what your financial resources are, is it really sustainable?
Yeah.
Are you really going to be able to do that each and every time? We live in Buffalo. Are you really going to drive through a massive snowstorm or torrential downpour in a thunderstorm 2.5 hours each way? Do that. So while you may find a provider who you think is ideal, someone close by who's logistically possible may make a lot more sense.
And some of our individuals love car rides. So maybe the 2.5 hour trek is fun and entertaining, and it's an adventure, but other folks can't tolerate the car. So you have to think about that.
Yeah. And what's the environment like? Forget about even the office. If you're from a rural community and now you're going to a major medical center in an inner city, how comfortable are you with that as a parent? What type of sensory overload might there be for a child? A lot of our kids, elopement, right? No safety awareness in traffic and other things. We had a child we treated off and on for years, and for whatever reason, fire trucks were a trigger when they had a siren. He'd disrobe completely and start running down the street. Well, the hospital-based clinic he was going to was next to a fire station. I mean, so things to think about and consider. We had mentioned this before. What is the walk up going to be? All medical centers should be handicap accessible. However, if your child can't ride in an elevator, and the practice is on the 8th floor, it may be the best practice in town, but it may not be one that you can, that accommodates you. And then especially if you are going to a practice that does not have an autism or IDDD focus, and more of a neurotypical mental health focus, or primary care practice that doesn't have a focus with people with developmental disabilities, what's the waiting room going to be like? What's the office space going to be like? I used to do, I think, wonderful care in a community-based mental health center that typically wouldn't have taken nonverbal autistic children, but they allowed them to be seen there because I was there. But the offices were built for neurotypical children, and the offices were shared. So I shared an office with a bunch of therapists. I was there twice a week, and they're there other times. So we had books and play therapy toys and puppets and all that stuff. 50% of my appointments were a massive meltdown and the office being destroyed because it was so overwhelming for that child that it prevented treatment from happening effectively there. So these are things that you want to consider, at least at the beginning. Obviously, if you need an appointment, you need follow-up, you're going to take what you can get, but at least start. If you do have choices, these are a great way to evaluate. And I would, how can you evaluate this with help and support? I'll tell you, if there's an autism or other type support group in your community, moms know which docs work well, which docs don't work well, who's got long waits in the waiting room and things like that. Very often primary care physicians, particularly those maybe developmental pediatricians and others who have a lot of these folks in their practice, have built relationships with various psychiatric practices that can be very helpful. I will caution the use of internet services and things like Google and Health Grades. They can be good resources, kind of like people who review restaurants. The only type of reviews you get are people who love them,
good or bad,
or people who hate them. And so it's information that's valuable to look at, but take it with a grain of salt. So those are really, I think, my top 10 things to think about when you start trying to look at practice.
I agree. I think parents with a child on the spectrum is probably the best resource to sit and chat about all of these details and nuances that you're not going to get from a plain Google search. Thank you. I appreciate you covering that. Next episode, we really wanted to focus on how to prepare for the upcoming visit with the provider, because you only have a limited time and you want to make the most of it.
Absolutely, a very important topic, and I think a lot of failures in the provider-family relationship is based on expectations that are maybe not realistic expectations. So we'll give a lot of pointers about how to make those appointments the most successful that they can possibly be.
Excellent. Till next time.
APEC out.